Hi everyone, how you doing? Today let's talk about cheap veneers versus very expensive veneers. What's the difference? Should you pay more? And how much of it has something to do with the quality of the materials used? Actually, very little has something to do with the materials, but we'll get into that in a second. So my name's Gus, I'm a cosmetic and implant dentist based near London in the UK. And this video is going to be completely biased towards the expensive veneers, okay? I think on the whole scale of things, we are on the higher end in terms of cost, okay? So our veneers cost about £1,200 per tooth. I know there's places which charge £2,000 to £3,000 per tooth, okay? But these are very, very few places. The average cost of a really good quality veneer in the UK, I think, is between £800 and £1,200. Now, if you have done any kind of research into this, you're thinking about getting veneers, you'll know that there's a load of places offering much lower cost for the veneers. And I've done videos on this in the past. Now I'll split this up into three key areas. First of all, we've got the experience of the dentist. Then we've got the process of smile design, and this I think is probably the most important part of the whole thing, and this contributes a lot to the cost. And then we've got the actual materials and the quality of the labs which are used, and this again is really, really important. Now in these three areas, if you take the top of each one, obviously you're going to end up with the most expensive veneer. So let's look at the experience of a dentist. Now different people, when they're going down this journey of looking at veneers, some of them just want block white teeth, okay, and that's easy. Any dentist with zero experience can do this. But if we want something really natural which just makes it look like you were born with really good teeth, this takes skill and experience, and this is where the experience of the dentist really comes in. Just because a dentist is old and got loads of white hairs, it doesn't mean that they are experienced. You see, in the UK, a lot of dentists, all they do is kind of family dentistry, just general dentistry. You see the dentist every 6 months, you have a filling, you might have a crown, that kind of stuff, you know, essentially basic level stuff. When you're looking at cosmetics and treating the whole mouth, it's a different art form. So if you go to someone who does this quite a lot, they're probably going to be more expensive because they have more experience in the field. Now, if they're experienced, they're going to have all the latest equipment in the practice, and they're going to know how to get you from where you are to where you want to be in the kind of the most smoothest way possible. Whereas someone who is inexperienced in veneers, they may have gone on all of the courses but not actually done things hands-on, it's gonna be a little bit, it's not quite going to be as smooth a journey. They'll probably still be able to get you there, but you might need more visits and more issues along the way. Next, we've got the quality of the lab. Okay, the veneers which you have done are not made by the dentist, they're made by somebody else. And this is a dental lab. These are dental technicians who are skilled in making things out of porcelain. By the way, this whole video is all about porcelain veneers, not for composite veneers. Composite veneers are something which a dentist can just stick onto the teeth in one visit. They're kind of a quick fix. They generally don't look very good and they don't last as well as porcelain. So if we're going down the route of a proper smile design, I would always recommend porcelain over composite veneers. Anyway, back to the lab. So a lot of dentists think that the dentist is the artist, when actually it's the guys in the lab who you never see. These people can make teeth look natural. Now, in the way that I do smile designs, we'll make everything out of temporary materials to get the shape right, but everything beyond the shape and the length of the teeth is really a prescription given to the technicians, and they can add different colors from the neck of the tooth to the middle of the tooth to the tip of the tooth to make the tooth look natural. If we wanted to cut corners here, we would just have one block white tooth, which we've all seen people like that. It looks just like a wall of teeth, okay? And if that's the look you're going for, anyone can do that. But if you're going to spend a bit of money, this is where your money is going, in making things look more natural. So we can choose the color of the teeth, but a natural tooth has more yellow at the neck near the gum and actually has more blue near the tip, because the tip is thinner, it's more translucent. Now, as we age, we get less and less blue and more yellow, and it's really the skill of the technician to kind of balance these micro colors. But in addition to colors, we also have texture. Teeth are not perfectly smooth. They have a certain amount of texture. They have horizontal lines and they have vertical lines on them. The horizontal lines are nearer the gum, they're not all the way down the tooth, and the vertical lines can be a bit more uniform. So younger teeth tend to have more of this surface texture on them than older teeth. And the reason is due to normal diet, acids in our diet, and just everyday brushing of the teeth, we essentially smooth our teeth down. So we lose a little bit of this texture. But this texture is really important because what it does when you've got light hitting the tooth, it scatters the light, and this scattering of the light makes the tooth look more brighter, but also makes it more youthful and natural looking. Okay, these are tiny little details which we are looking at here, which nobody would actually see if you had a whole load of veneers done and we compared really expensive veneers versus the entry level veneers, if we can call it that. Then you wouldn't say, oh, that one's got more texture. You'd say that one actually looks nicer, it looks more natural, but it's because of the texture and the variation in colors and the individuality in shape of the teeth, that's what's making it look more natural. Talking about the shape of the teeth, let's talk about the process of smile design. Okay, so smile design is essentially having a full set of veneers or mixing implants, veneers, whatever it is, just redesigning that smile, making it look really good. Now, a lot of dentists, when they're doing this kind of stuff, will have something called a wax up done. And a wax up is essentially the lab technician building up the teeth into veneers on what they think looks good. But those guys, they're working on just a model and a couple of photos. So the way we do it is we do everything, we essentially do the wax up in the patient's mouth right there and then. So we've got full control over the shape of the teeth. Are they going to be more triangular? Are they going to be squarer? The edges of the teeth at the bottom, do we want the front two teeth to be kind of level with the side teeth, or do we want the side teeth to be shorter? Are they going to follow the smile line? Where's the midline? All of this kind of stuff we want full control over. Now, I take control over this because I'm a bit of a control freak in this sense. By creating a full smile in the patient's mouth, I'm able to let the patient go home and trial out what it's going to look like. Then when they come back, we can make modifications. Now, if we look at this case, this lady had quite long teeth. There's a whole bunch of other things going on here. And we made the first trial smile. That's what we call it when we build everything up in temporary materials. We like it because, it rhymes. So she went home with a trial smile. I thought she'd be like super over the moon, but the next day she emailed, she's like, I need to see you urgently, this is really bad. So I'm thinking the worst, but actually all it was, we needed to shorten the teeth by 1 millimeter or so. But without going through this process of doing the trial smile and letting the patient test it at home without any numbness, without the pressure of me and the nurse looking at her to gauge her response when she looks in the mirror, she's able to do this comfortably, get the opinion of friends and family, and then come back. Now, adding a trial smile appointment takes time, and having a review appointment takes time, and then taking records of the trial smile once it's in, sending it to the lab, and the lab having to copy that, again takes skill and time from the lab. So all of these things are a part of this process, which makes this whole smile design thing much more complicated. Now, it doesn't need to be this complicated, but as soon as you start cutting elements of this out, you lose control, and we could end up giving patients veneers which they hate the look of. Granted, this probably won't happen that often, but if you're that patient who has these veneers done and in your head you're thinking you're going to look one way, but when you look in the mirror it looks a different way, you're probably not going to be super happy about it. And that's a key difference. Now, if you're going to a dentist who is less experienced, they may not be able to manage your expectations. So again, this is coming back to, what are you looking for? Are you looking for that perfect natural looking smile, or are you looking for block white, wall to wall, Rylan from X Factor look. So I hope this video has enlightened you a little bit, mainly about the process, because that's where the real cost of veneers comes in. And if you are thinking about getting this done, you go and see a few dentists, get a number of different opinions. It may be that with less invasive treatments, like maybe just whitening and a bit of edge bonding, you could get that dream smile. And remember, veneers is a fantastic treatment. It will transform your smile, and it can look really, really good. And there's ways to make it very minimal treatment. It is an expensive treatment, and there might be other options out there for you. So I hope you found this useful. Hope you found it somewhat enlightening. If you did, please give it a thumbs up. You can contact me on this social media or any others. There's a link below, and I will see you again soon in another video. Take care.